Welcome to Introduction to Special Patients. Here are our chapter objectives. We want to identify the terms appropriate for patients with special needs, learn how to manage patients with developmental disabilities or complex medical issues, describe best practices to interact with patients with special healthcare needs, and implement a strategy for determining an individualized treatment approach. Defining special needs. These are patients with medical, physical, psychological, or social situations that make it necessary to modify normal dental routines to provide dental treatment for that individual. Special needs can be temporary or permanent. They can be physical, emotional, or psychosocial impairments, and the disabilities have no age limitations. How does the condition influence the delivery of dental services? Well, the dental hygienists review current literature about the patient's conditions and develop some familiarity with symptoms and drugs commonly prescribed for these patients and their conditions. There are many categories of disabilities. They go all the way from self-care disability, which is self-explanatory. The patient cannot manage themselves. They need help just to live every day. Intellectual disability, they may be cognitively impaired. This can be congenital or acquired. Sensory disability, any disability relating to a sensory organ such as sight and sound. Psychosocial disability, behaviors inappropriate with social interrelations. And physical disability, any impairment to physical activity. And if you look at there's a chart 36-1 in the grouping, and by far in both age groups, the largest groups have difficulty going outside or physical disabilities. Now, when considering management of these patients, you need to think about the management of patients. How stable are they health-wise? You would need to determine what ASA classification they fall into. This might require a physician consult. You want to have an accurate medical history, and you need to consider comorbidities. So they have multiple chronic diseases. With medications, you need to review drug interactions for analgesics, antibiotics, or anesthetics that you want to use. You want to watch for medication-induced xerostomia, and remember that if you need oral sedation, you may not use a sedative because sometimes that can have a paradoxical effect on these patients, and they may actually become more agitated or alert. You need to consider the patient cognitive ability, and that can be anywhere from mild to severe. You need to assess the level of understanding of not only the patient, but the caregiver and the legal guardian. And I say this because sometimes the caregiver is just that, the caregiver. They are not the one making the legal decisions. So you need to know that. Ask questions multiple ways and have the patient repeat back to you or paraphrase back to you what you said so you can determine their level of cooperation. It's also good to consider whether the office setting is appropriate and whether your support staff has experience. Maybe the dental hygienist has never seen a special needs patient and may need to consult with another hygienist who has, or review some information. And same thing with the dentist. The dentist may have no experience in dealing with a special needs or a patient with special needs, And I'm saying that because remember, we want to talk about these patients as if they are people first. So we don't talk about them as special needs patients, but we talk about them as patients or people with special needs, not a hearing impaired person, but a person with hearing impairment. You consider the person first. We also, if we do not have the support staff, multiple people, we may need to educate some people or educate yourself. This is a review of the ASA classifications. I would assume you already know these, but I put this up here for a quick review. ASA 1 is normal and healthy. ASA 2 is mild systemic disease. ASA 3 is severe systemic disease. And obviously ASA 4 through 6 would not be patients we would see in the office. Okay, other management considerations include how many times has the dental hygienist treated a patient with special needs? How many times have they been treated in a routine setting? What was their last visit like? Did the patient have preferences? And it's going to be very important that you try to establish trust with this patient, because that's going to be the goal to getting to where you can actually treat them. But you want to know all about the last time they had hospital dentistry or general anesthesia, if they had dental local anesthesia, if you're planning on using anesthetic. You may want to use phentolamine mesylate because that's a vasodilator that reverses the dental local anesthesia, so the patient is less likely to chew themselves up. Oral medication should be used as an aid and not as a crutch. So assess the patient's reaction to oral sedation in the past. Of course, with the xerostomia, you want to assess them for caries and what you might do to help prevent it. You might want to put these patients in a fluoride tray or give them daily fluoride. And you may also have a risk of greater periodontal disease. And you need to consider cardiovascular fitness, respiratory tolerance, neurological concerns, hepatic function, and renal function. And you'll want to get medical clearance if you have problems with the liver or renal function. So be sure you check with the PCP. And please understand, when dealing with these patients with special needs, that behavioral management is a little bit different. You have to explain everything you're doing. They're coming into an unfamiliar environment, which is already upsetting to them. You should not just put them in the chair, lean back, and turn the light on without telling them what you're going to do, and you're going to do it slowly. You want to try to desensitize them. It always helps to tell, show, and do. And you are going to have to be an active listener so you can hear what they are telling you about their experience. You can help them visualize what they were going to do. And it's not so much about time management of getting the complete prophy done the first appointment. You don't want to rush things. You basically want the patient to get comfortable, and if they have to come back to finish their treatment, that's fine. But you don't want to push them past their limits. And you're going to have a great partnership with their family and caregivers, knowing that they are your helpers in getting this treatment done. You may consider some medical management, nitrous oxide, but understand that this may make some patients feel claustrophobic. You can use some oral sedation. Again, you would want to ask about the patient use of this medication in the past, and if it was successful, you may want to immobilize or stabilize, and you could use something like mouth props or papoose boards, or sometimes just a weighted blanket, which is comforting to the patient. But you have to take it slowly and kind of feel your way along. You want to modify, try to help them, especially those who have physical limitations. You may need to make modifications to their oral hygiene products. Let's say they have severe arthritis. You may want to find a large rubber ball that they can actually hold on to and make a hole in it and put the toothbrush in there so that they can hang on to it. There are some patients that have special toothbrushes that attach to the sink where the patient can lean over and brush their teeth even if they cannot use their hands. So there's all kinds of ways of getting around it. Then you want to actively institute a preventive and disease management program from the standpoint of caries and periodontal disease. And we'll talk in the next chapter about how some of these diseases, particularly cardiovascular disease, can contribute to the periodontal disease. So categorizing patients appropriately based on their developmental disabilities will help you recognize the best practices in formulating treatment plans. Having a clear understanding of behavioral and medical management allows the clinician to acknowledge that traditional methods or practices may not equate to the needs of patients with developmental disabilities. You may need to tweak it, and one of those things may be using restriction or immobilization, but you have to ask permission each and every time you use some kind of restrictive or immobilization device. And understand that dental implications that are suitable for patients with developmental disabilities helps you in an easier transition for the dental team. Okay, let's talk about a 34-year-old patient with autism presents at the clinic for scaling and root planing. The hygienist reviews the patient's health history and notices that the patient may have had a history of subacute bacterial endocarditis. When asked about the finding, the patient's caregiver responds, "That heart thing was before I took care of him over 3 years ago." The other hygienist saw him last week for scaling and root planing on the other side and did not give antibiotics. So, would you just go ahead and proceed? No, because you know that a patient who has a previous history of infective endocarditis needs to be pre-medicated. So you would stop, consult with the physician, and reappoint. So you go about this by consider the recommendations provided by the primary care physician, proceed with treatment before following up with the patient's physician, seek advice to the dental clinician as to the best course of action to obtain medical consult, or ask the legal guardian for more information. Ask only the patient requiring past appointments and need for antibiotics. What do you think is the right answer? And there's 2 responses. Well, it's not B, and it's not E, so that narrows it down for you. You could consult with their primary care physician. That would be a good thing to do. Or seek advice from the dentist as to the best course of action to obtain medical consult. And he is or she is then going to say, call the physician. Which of the following would not affect the experience of an obvious office environment for this patient? Well, we know that noxious odors can affect people with sensory disorders, parking availability, sound volume, or brightness of the room lighting. And if you picked B, parking availability would not affect the experience because this patient is probably not going to be driving, or if they're able to drive, they will not have that much trouble with it. Desensitization is a process that helps introduce patients with special health care needs to the environment of a dental office. The process involves all of the following except which one? Take a minute to think about these. Which one is the exception? If you said A, positioning the dental light with quick and abrupt movements, you are correct. That's not how you desensitize a patient. Remember, you are acting slowly. They've never been in this environment, or they don't go to this environment often, so let them fill it out. And here's our references. Okay, I will see you next time.